Hello, everybody. Hello, everyone, and welcome back again to my channel. I hope you're doing well, great, as I'm doing well as well, and excellent. If you are not yet subscribed to my channel, please do hit the button of subscribe, like or comment so you will be updated of the topics that I'm going to share with you for further knowledge. Without further ado, we're going to tackle this video on the delegation process on NCLEX. Now, the delegation process is very important in field of nursing because as a nurse, you have your own duties and responsibilities, and as well as to your licensed practical nurse, and as well as to your UAP or the unlicensed assistant personnel. So each of them have their own distinctions of duties and responsibilities to delegate to by the nurse to the LPN, and LPN can delegate to UAP as well. Okay, without further ado, let's talk about first with the registered nurse duties and responsibilities. Of course, as a nurse, you could do assessment. That's in the process of ADPI, so you could do all those things. Primarily assessment, the planning of activities or the treatment and the care to the client, evaluation of the outcomes, evaluation of the procedure to the client, what are the things that happen to the client, is it effective or not? So that's part and responsibility of the nurse. Teaching as well, of course, you're going to give what is important for the procedure or after the procedure, medications, what are the effects of this, or positioning or something like that. Those are the teaching that you could assist the client or help the client. Education or giving a demonstration for the procedure or positioning. So those are responsibility of nurse. Check on that. Client admission, of course, a nurse can admit clients, and then also can call code operator during the code. So the nurse should do that, not the LPN. Okay, medication administration, of course, IV push and any kind of medication. Check on that. Starting an IV line, of course, the nurse can do that as well. Care plans, as I have told you, the planning of the treatment regimen and everything for the client is included. Receiving and giving reports from the LPN and the UAP. So giving report, receive report from LPN into the UAP and give report to the physician or the doctor. It's responsibility also of the nurse. Okay, check on that. And of course, don't forget evaluation again of the outcomes where in the nurse delegate the task to LPN and to the unlicensed assistant personnel. So the nurse is also responsible for that if those tasks given to them are done or they are effective or not effective. So those are the responsibility and duties of RN. So don't forget these things. These are important, and don't mix with the functions and responsibility of the LPN. Okay, now let's talk about for the licensed practical nurse or the licensed vocational nurse. So these are the duties and responsibilities of the LPN. Of course, the nurse should delegate clients who are only chronic and stable. So it means chronic, they are probably more stable than a complex client or those who have acute conditions. So you cannot just delegate to the LPN, but you could delegate to RN, okay? So that's for the LPN. So if they are stable, you can delegate to practical nurse, okay? Also, you could delegate the client with a post-operative 24 hours if they are also stable, but acute and unstable client, you need to delegate that to another RN, okay? Another is the LPN can administer medication. Definitely, yes, they can, but not IV push, okay? No IV push for the LPN. Remember that, okay? Now, it's the LPN can teach. Definitely, they can teach, but only reinforcement. After the RN already give teachings and educations to the client, and that's the time that the LPN can teach and reinforce what the nurse have done to the client. So remember that reinforcement can also be done. Diagnostic tests, a common diagnostic tests such as X-ray, laboratory, common laboratory, but need to be stable. Remember, must be stable, okay? They can also do the IV catheterization, insertion, and as well as the removing, okay? So remember, they can do that, okay? Monitoring of the IV flow rate as well. So don't forget, they can do that. NGT medication. Yes, they can, remember meds, they can do that, but not IV push. Okay, NGT removal and decontamination. LPN can do that, but not inserting of the NGT, okay? So they can decontaminate, they can remove, okay? So LPN, okay. They can also do obtain specimen. Yes, they can do that, okay? Then patient for discharge, but not complicated teachings, okay? Now patient for discharge, stable client, they can give teachings but not complicated. For instance, for diabetes mellitus medications, so they can, like the insulin, they cannot do that unless the RN should do those things, okay? Remember, if this you think are complicated teachings, these are for RN. But if not complicated and easily understand by the client, then that is for LPN. Okay, remember these pointers. Okay, that's for the LPN. Now, the unlicensed assistant personnel duties and responsibility. Remember, they have no license, but they are trained, okay? So that's why for UAP, these are their duties and responsibilities, okay? Stable patients only. Again, stable patients only that has no complicated condition, that has no other underlying condition that could cause further complications. Remember that no teachings, they cannot teach, remember? So the teaching, primary teaching is for registered nurse, okay? Reinforcement is for LPN. Also, UAP, no medication. They cannot give any form of medications, either for oral or for anal, no, okay? Feeding, yes, they can feed the client as part of the activities of daily living, but for stable clients, no choking hazard, okay? If the client is stroke and have problem with swallowing, feeding cannot be done by UAP, okay? So, but if able to swallow and they are good, okay, stable clients, yes, they can do feedings. They can also do the vital signs. Remember that. Transfer. So these are the duties and responsibility of the UAP. Activities of daily living like walking, grooming, bathing, okay, changing clothes, UAP, okay? Remember that those are the ADLs, okay? Range of motion exercises, yes, they can do that at the bed of the client. Measuring intake and output, okay, like collecting, okay, measuring and that, but to interpret, nurse, okay, registered nurse. Remember, okay, can bring medical records. Of course, they can just bring that and give it to the nurse, okay? Then they also can provide enema. Yes, UAP can provide enema, okay? So if they were asked, of course, with the UAP, LPN, and then the registered nurse, you choose the UAP because they can provide this enema, okay? Taking empty blood bag, okay, because it's already empty, they can do that. But if that is for the beginning of the blood transfusion, the registered nurse will do that, okay? Remember that. Obtain a clean specimen. Can they do obtain sputum specimen? No, the LPN can do that, okay? Obtain a clean specimen, like the urine, okay, in a closed, closed system, okay? Morning care, of course. What are the example of the morning care? Toothbrush, combing of hair, like the activities of daily living, and then weighing is also important. Okay, that's part of the UAP. So telemetry, like lead placement, so the UAP can also do that. Bed making and preparation of the bed, UAP. And escorting the clients or the patient from the other place or to the sala area. So like they wanted to watch or meet, go to the garden or something like that, so they could escort the patient. UAP can do that. Compression stocking is also unlicensed assistant of the UAP. Remember that, because they gonna provide a but for assessment. If the nurse, they could check if the compression stocking is well placed. So that is for RN, okay? And post-mortem care, okay, can be done by UAP, okay? Post-mortem care, okay? So that's for UAP. So remember this duties and responsibility of the UAP. This would help you to answer some of the questions on NCLEX, like 2 or 3 or 4 or up to 5 questions. They will give this questions. Okay, now this is the summary of what I have talked about for RN, for LPN, and for the UAP. Okay, so this what are the things, especially for registered nurse. Remember, they are the one for assessment, planning, teaching, educating the client, demonstrating, okay, so giving medications, care plans. So those are for RN. For LPN, of course, chronic and stable clients, they can give medication but not IV. They can reinforce stitching. They can insert catheterization and pull it out. And also for NGT, they can give meds through NGT. They can also remove the NGT but not inserting, okay? So those are for LPN. And for your unlicensed assistant personnel, this is the list of their duties and responsibility. For stable patients only, no teachings, no medications. They can feed for stable clients. They can do vital signs, transfers, activities of daily livings, and everything and so on. Okay, so I hope you learned from this. That ends. Know your duties and responsibilities as an RN and how to delegate these tasks. And this would also helpful, especially when you are working in hospital SNF, okay, something like that. But specifically for NCLEX, these are the things that you need to know. I hope you learned from this, and thank you and God bless.